Hi, and welcome to the Psych Health and Safety podcast. My name is Jason Van Schie, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. But before I introduce our topic and guest for today, allow me to introduce my co-host, Joel Mitchell. How are you today, Joel?
I'm tired again. I feel like I'm always tired, but this time it was because it sounded like there was thunder actually inside my house overnight, which woke me up, and then I was awake wondering who else in the house it woke up, but apparently it was just me. So
yeah, I hate it when there's thunder inside my house.
It's the worst.
Yeah.
But I've been listening to Rob Lowe's podcast called Literally.
Did you have a teen crush on Rob Lowe?
No, he's a bit he was more sort of 70s, 80s. So no, he's a bit old for me.
Yeah, actually, no, you're probably a little bit young at the time. Yeah. I know some people who are probably 5 to 10 years older than you.
Yeah.
That was their thing.
No, he wasn't my teenage heartthrob. No, that was more like the Brad Pitt, Leonardo DiCaprio crowd. Yeah.
Rob Lowe's great, and he doesn't take himself too seriously.
He's so funny. Yeah. He's so funny and he's very self-deprecating.
Yeah.
So
he'd make a good Aussie.
Probably. Yeah, probably. So it's just like he just seems to be getting his friends on, like his celebrity friends, and they just talk about stuff. He's friends with Magic Johnson.
Of course he is.
Of course he is, yeah. I didn't listen to that episode because I don't care about basketball.
Or sport.
No, or sport at all. So I've listened to the first episode he did with Chris Pratt, which was very funny, and they worked together on Parks and Rec. So that was just, that was hilarious. And the one I'm listening to. Why have you
not told me about this? You know I like Chris Pratt.
Because I only started listening to it yesterday.
Well, you could have told me this morning.
Well, I'm saving it for now.
I'm sad. Okay.
Now you're complaining at me, and our listeners have to see this. Listeners, this is what I have to deal with every day in the office.
What was the name of the podcast?
Literally.
Literally?
Literally.
Okay. Literally is the name.
It is literally Rob Lowe's podcast.
All right. I'm listening to it on the way home today.
So the one I'm in at the moment is with Conan O'Brien, which is also hilarious. And they're talking about sharks and how Conan O'Brien looks pathetic when he's on the beach compared to Rob Lowe, who looks like a chiseled Adonis. So yeah, it's good. It's a good funny podcast to listen to. But that's enough about promoting other people's podcasts, I think.
Yeah, no, we should probably do our own podcast.
Yeah. Not as funny as that one probably, but we do our best.
Not. I mean, we could probably do another podcast, right? Like a comedy one.
I'm sure we could. I don't know that we'd get the same listenership.
Probably a different group.
Maybe, yeah. Although, I mean, our humor is fairly niche, so we might actually appeal to sort of some of the same listenership that listens to us now.
Possibly.
Yeah.
All right. Well, let's introduce our guest then.
Yes, good idea.
Okay. So he has collaborated extensively with the European Agency for Safety and Health at Work and the Society of Occupational Medicine, and has particular interest in the working conditions and wellbeing of healthcare workers. He has published in journals such as Work and Stress and the Journal of Occupational Health Psychology, and is a regular conference speaker. He's a senior lecturer and program director of the Masters of Organizational Psychology program at Birkbeck, University of London. Welcome to the podcast, Dr. Kevin Teoh.
Thank you, Jason. Thank you, Joel. I was just listening and reflecting on everything that you were sharing before, and I want to jump into the Rob Lowe conversation too, when that was appropriate. I mean, my take on it was that he just never seems to age. He just looks exactly the same.
Right, because he doesn't eat any carbs, according to this latest commercial I saw him on. So
I did hear him talking about Atkins. Yeah, yeah. So was did you have a teenage crush on Rob Lowe, Kevin?
No, I think he's also a little bit too old. But I don't even know how to answer that question, to be perfectly honest. But I just think that any show that you've got Rob Lowe in it, you're off to a good start already.
Yeah, that's right. Yeah, he's so diverse as well. He's across everything, isn't he?
My favorite was The Grinder, and it lasted one season, and then got cancelled, and I was very upset because it's just so funny.
Yeah, well, Kevin, really great to have you on. It was actually another one of our listeners, Tim Ackroyd, who was one of your students at Birkbeck, that suggested that we get you on. So, really glad that you agreed, and I'm really looking forward to the conversation today.
Thank you. No, I'm delighted to be here, and I've always said that our students are they're my little change agents. They go out and change the world in terms of what they do. And I guess in this instance, sign me up to do podcasts on the other side of the world.
That's right. Well, awesome to have you on.
Yes, we love a good referral.
Yes.
From our guests. We know that they only refer quality. So no pressure, Kevin.
Well, indeed, I do feel the pressure right now.
All right. So to ease us in, we were just talking about podcasts. Do you have any podcasts that you like to listen to?
Yeah, quite a few. Although I have to say that I'm not listening to as many as I was before. And a big reason, I think, is the pandemic. I live outside London, so I used to commute into London, and that was part of my commuting experience. And while I certainly don't miss that commute anymore, I'm currently maybe going into the office one day a week. One thing I have realized actually is that I'm not listening to podcasts anymore. And a big part is that I just haven't got that opportunity. I think it's part of that I start work and I end work. That's sort of the start and end of the shift kind of routine, and I just don't have that anymore. I roll out of bed and get into work, and I switch work off and then carry on my whatever I do at home. So there's that element. But in terms of podcasts that I still listen to, or I guess I would class as my favorites, there's this BBC program called More or Less. It's about behind the numbers, and what it's all about. It breaks down statistics and figures and data that's being presented in our everyday lives. So it's got a slight political stance to it. So they break down numbers which politicians use in across the world actually. So particularly with events in the last few years, whenever someone says this is the rate of something or this is the prevalence of something, they'll dig behind the numbers to actually see what goes on. And they also break down a lot of the commonly used numbers that we see, figures that we bandy about. And as a data geek, it's quite interesting, and I often talk to my students about this because it kind of increases the salience and the importance of why we actually need to have an understanding of numbers and also basic research methods around that. So I think that's one I would often recommend to people, particularly if you have an affinity for numbers. If you're terrified of numbers, then maybe you should stay away.
Yeah, I think the advice that I always give to psychology students is, even if you don't plan a career in research, those research methods units are probably going to be the most useful out of everything that you do in your entire psych degree, especially undergrad, because that's essentially what your job is to look at the research and decide what's going to be the best approach to use for whatever situation you're confronted with in your work. So even if you're not actually doing the research, you need to be able to read it and see what's good research and what's rubbish and what's overreaching and all of that sort of thing. So understanding how the numbers work and what makes up good research is really core to what we do.
Yeah, I teach research methods as well. So often I spend the first couple of lectures trying to bring that message home with our students to say it's not just exactly as you said about the research, but it's about everyday life as well. And particularly in the last few years with politics and with the pandemic, everyone's talking about science and everyone's an expert in terms of evidence. And actually, how do you know that? How do we know what we need to know? And all that knowledge is transferable to everything that's out there. So if you don't want to be taken in, then you really have to be able to think and appreciate the evidence that's in front of you.
Yeah, absolutely. So can you tell us about your professional career, please?
So my background's in psychology. It's sort of always been in psychology. I did an undergraduate degree in the UK. I actually did my first year in Malaysia. So I grew up in Southeast Asia before I went off to the UK. Then I worked for a few years in sort of research consultancy. My initial plan was actually to go on, as with many young, naive psychology students, to go into clinical psychology. But then I did, as part of my placements and training, I did some experience with a mental health center, and actually realized that while I really enjoyed the work, everyone there just seemed really, I'm talking about the staff, burnt out, tired. And I felt that if I was going to be in an environment, I could see myself in 10, 15 years being exactly the same position. And that didn't quite appeal to me. And equally, reflecting on a lot of the client work that we were doing, I also felt that these were individuals who really, at the end, they've been institutionalized, they've been on medication, which all is important as part of the recovery of an individual. But I felt that actually a lot of them had a lot more support earlier on in their journeys than actually, a number of them perhaps might not have been in that position. And that started leading me to think a little bit more about actually, well, we need to focus more on preventative care, and reflecting that we spend so much of our time in and around work that actually, if we can make workplaces healthier and better, then that's a lot more sustainable. And equally, around the same time, I did a 3-month internship with a law firm, because actually in my undergraduate program, I didn't take any of the optional modules I could do on work psychology, mainly because I wasn't interested in organizations in the corporate world. I felt that's not my scene. But I thought, in interest of fairness, before I rule it out completely, I should get some corporate experience, which I did. And after that 3 months, I realized actually, I didn't corporate world wasn't quite for me. I'm happy to dab in and dab out, but I wouldn't want to work in day out. But what I found fascinating was the application of psychology into work. And again, coming from undergraduate psychology, the opportunity and experience to say, look, we want to do something, we want to try something, that actually is what work psychology gave me the opportunity to do. So from there, I then went on to do an MSc at the University of Nottingham in occupational psychology, worked for a year in consulting, a lot of projects at the European level, looking at how we implement policies, develop resources for different European countries around workplace stress. And then eventually I moved on to Birkbeck, again in a research role, before then doing a PhD looking at working conditions of hospital doctors. Trying to link the data that we have on the working conditions of hospital doctors, how that impacted their well-being, and then in turn the quality of care that they were providing to patients. So really trying to generate again data to support arguments that we need more holistic perspectives, which I think is something that we'll talk about later on. So in a nutshell, that's a little bit about my story.
Yep. So I think lots of a fairly common narrative there for lots of people who go on to study organizational or occupational psychology, going through that process of imagining yourself doing clinical work, and then as you're going through the undergrad, you're realizing that's probably not quite what's hitting the mark for you, and thinking about those opportunities to be proactive and prevent harm.
Yeah, very, very similar to myself. I thought, I'd leave university and go into clinical psychology. And then I did a stint with a telephone counselling service, and I thought, no, this is really not me. I thought, well, what else can I do? And sports psychology is very limited in terms of a career path. And so organizational psychology was the next best thing. I always had an interest in commerce and business as well. So
my mum's friends would actually laugh when she told them that I was studying psychology, because
why is that? Because you're not very empathetic and caring?
Basically, yeah. They I think one of them said she's just going to tell them to get over it.
I can imagine that. Yeah, good
I
thing
think
for the clinicals. Sorry, Kevin.
Sorry, I was going to say there are some counselling and therapeutic approaches which embrace that. I can't remember which one. I'm trying to think back to my undergraduate degrees now. Rational behavioral therapy, which is essentially get over it, and it involves the therapist throwing profanities at the patient to
you missed your calling, Joel.
Why did I not learn about this in undergrad? I could fully get down with that kind of a therapeutic approach. Yeah, swearing, getting paid to swear at my clients. Amazing. I mean, I get paid to swear at you, so that's,
pretty much. Well, that's really not part of your job description. I think you've just added that in.
You enjoy it.
It's pretty funny.
Well, there is actually good research saying that when people swear, they talk about more in terms of pain management. Actually, swearing helps with that, and with relieving stress as well. So it is actually a form of coping mechanism.
And intelligence, isn't it? It's a sign of intelligence. Greater
I'm
levels
not sure,
of cursing.
I'll give you that. And we'll put
it was a media headline, so it had to be true.
Oh yeah, of course. Yeah, was it on Facebook?
It was in all the newspapers.
On all the Twitterverse. Yeah. Well, obviously, research is a key part still, Kevin, of what you do. So, what is your main research area at the moment?
I mean, we were just talking about individual therapy and all that. And actually, what's ironic as a psychologist is that I found that over my career, I've moved away from the individual and actually much more about the system and environment that someone is situated within. And I think that goes back to the idea of more preventative work, because recognizing that we are the products of our system. Yes, we as individuals contribute a lot to that, but therefore we need to focus on that environment. And because of that, a lot of my research looks at psychosocial working conditions. So how workplaces are designed, organized, managed. You can see your heads nodding, and really I'm sort of talking to experts in this field as well. So and
you're also talking to our listeners, though.
Yeah, this is what the show's all about, Kevin.
and well, I'm sure many of the listeners are interested, have an understanding in this. But yeah, so psychosocial working conditions, how workplaces are designed, organized, managed, what impact it has on their health and well-being. So that's a big part of what I do. I look at across different industries, although as Jason said at the top of the show, that my PhD looked at doctors, so I have an affinity for healthcare workers. That was pre-pandemic and even more so in the last few years. Trying to look at their working conditions, understanding how we can support them better. We've also alluded to research methods. So I'm also a bit of a methods guy, particularly with quantitative methods. So I'm quite interested in working with secondary data. And so, we collect so much data as part of our systems, as part of our organizations. So how can we use that better? How can we analyze that to support hypotheses that we have, to support decision making? How can we have better quality data? And I don't know if you've got any experience in this, but I've been invited into organizations who said, look, we've got this style survey. Can you help us make sense of it? And I've looked at it and gone, this is quite poor quality data. And actually, we can't do anything with this. And why have you collected this data? And they say, well, I don't know. We just thought it would be interesting to do so. And it doesn't really give you anything with that. So, I'm quite interested in secondary data analysis. And that also applies to meta-analysis. So the idea that we can collect data from different published studies and also unpublished studies to try and kind of average out and to say, look, rather than just look at the relationship that one study tells us, what does this relationship look like across 10 or 15 or 100 studies, to have a better understanding of what this might look like across different industries, across different populations. So in a nutshell, that's kind of the research that I do. And I don't know how that tails in with your experiences.
No, definitely. We see a lot of people who want to do, say, psych health and safety in their organizations being told, we've already run the employee engagement survey this year. Let's just use the data from that to do our psych risk assessment. And, yes, there might be some overlap, but we're really making a lot of assumptions about risk. And generally, if you want to understand risk, you have to unpack that a lot in focus groups and that sort of thing if you're using that secondary data source. So, Joelle and I think we don't really like the way that employee engagement surveys are typically applied, particularly when we're using it as a data source to inform psychosocial risk assessment. And we think it can be done a lot better than that. The other issue with employee engagement surveys using that as a data source is, it's done as a one-off activity and you're not really thinking about monitoring. So how are we monitoring hazards over time? We'll wait a year until we do the next employee engagement survey and then we'll see if our controls have been effective. Well, as we've seen in the last year, a lot can change in a year. So if you're waiting for the once a year survey to come around to understand hazards and controls, then you're really missing out on a lot. Yeah, but we definitely see the same, Kevin. And while there might be some good sources of secondary data out there, I think there's unfortunately some people are bundled into using some crap data as well.
Yeah, I guess like my background is more sort of safety and risk, and I think there's a lot of organisational data there that can be really useful to inform things like safety culture, for example, which is a really a growing field of research. And it seems like basically if you want to get a paper published, you just develop a safety culture survey, and that's a great way of getting a paper published. I don't know how useful it actually is to try to use a survey to measure safety culture, though. And I think that there is so much data that organisations already collect in relation to safety and sort of other indicators of culture that, the need for a separate survey or measure is probably not really there. So, interesting topic there.
Yeah, do you find it's quite easy to measure safety culture then, or from your response, I'm guessing not so, Joel?
It's easy to administer a safety culture survey. Whether you can actually then say that you've measured safety culture, which is a construct, not a thing. So yeah, I have fairly significant philosophical disagreement with the whole approach that suggests that you can put safety culture, or organizational culture for that matter, into any sort of normative framework. If you look at Shine's model of culture and how it develops over time, as an organization's response to internal and external challenges, and, what becomes an acceptable response to those challenges, trying to then put a normative structure over the top of that doesn't seem to make sense to me. So, but that's a whole separate discussion. It's got nothing to do with psych health and safety.
Look what you did, Kevin. You just opened a whole can of worms.
Yeah. No, yeah, we can. No, I do think it's got something to do with work. It's to do with working conditions and working environments, about how safe people feel. But I guess we could have a different discussion on challenges around measurement of different things. Yeah,
absolutely. But let's talk about psychosocial risk management, and particularly in the UK. What are some of the barriers that you've encountered as far as how psychosocial risk is managed at the moment?
Yeah, it's an interesting question, and I think it'll be interesting to see if this changes from your perspective. If it's different in Australia. I think with psychosocial risk management in the UK, I think one of the biggest challenges is that just workplace health in general is still seen as an individual level issue. So if someone is struggling with burnout or stress or poor mental health, then actually that's your concern. You haven't sorted it out. So why do we need to take a psychosocial approach? Because that suggests that as an organization, as an environment, we need to be doing something about it. But actually, we're not responsible for your mental. Sorry, I've got a bit of a cold, so I just have to clear my throat over there. But yeah, so I think that's one of the biggest challenges. It's still seen as an individual level issue. So often it's about getting organizations to shift their perspective, to say we need a more holistic approach. We need to take a more collective approach, or more preventative approach, and that's where psychosocial risks come into play. Or the other related challenge is that it might be seen as specific to certain functions. So psychosocial risk is therefore, it's a safety issue. It fits under occupational health, or health and safety have responsibility for that, when actually the reality is that we all again have a responsibility for that. So I think that's one of the biggest barriers, is actually understanding why we need to take a psychosocial risk approach in the workplace. And similar to that is, I think, also collectively there is a lack of everything, lack of time. Organizations, managers say we don't have time to do this. Lack of resources. What is this going to cost us? Do we need to have external consultants? What do we need to do about this? Well, again, we haven't got time, we haven't got money to do that, and a lack of knowledge. Well, again, what is psychosocial risks? Why do I have to do this? How do I do this? So I think that's some of the biggest challenges, I think, that come to mind when I think about some of the challenges that we have here in the UK. I don't know if that's any different to Australia.
I think we see, organizations sort of sit, I guess, across a spectrum of understanding about this, and some of them just need a little bit of a nudge to understand what we're talking about, and others are really still very firmly rooted in that, no, this is about individuals and their personal issues and them getting treatment and not bringing their problems to work and that sort of thing. So we really do see a pretty broad range of organisations in that space. There was a HBR article that came out that was looking at some comparative data from the US between 2019 and this year. And they were sort of doing some generational analysis as well, and they were seeing sort of increased rates of psychological ill health, and also expectations for employers to have psychologically health and safety workplaces among sort of millennials and Gen Z, is it? Is that sort of something that you've seen as well?
I think in general there is a bigger awareness across the board, even with older workers, on the importance of health and safety, psychosocial approaches. I do think that, if you think about some of the younger enterprises, the more startups, new media might be more aware and have more expectations around some of these psychosocial working conditions. I don't know how big, currently we talk about the Great Resignation, which is apparently sweeping across the US. I don't think that's necessarily translated into the UK, but I think as part of that narrative, there is this notion that currently where, if you're in employment, chances are you're in a role which is in demand, and therefore it's an individual's market to pick an employer that they want to work for. And as part of that, with everything that's been going on, and the bigger emphasis that we have had on mental health or on well-being, is that individuals are choosing environments or organizations which facilitate that. So they want the opportunity to work flexibly. They want that support for well-being. So I think we're seeing that. I wouldn't say necessarily just with younger workers, but I would actually argue across just the workforce more generally. Although I think you are splitting between people who have that privilege of having roles which are in demand versus those who are just desperate to have any form of work at the moment.
Yeah, that's absolutely the difference, isn't it? And that's where I guess those issues of power really come into play.
Yeah, and actually picking up on pandemic and how that's changing the world of work. And if you talk about psychosocial risk management in the UK, we know that from a legislation point of view, employers have the responsibility for maintaining a safe and healthy work environment. And that actually translates also to individuals working from home. So historically, that's always been a challenge, because employers say, well, that's someone's home. That's got nothing to do with us. In the pandemic now, where pretty much everyone has had to work from home, or who's been able to, the challenge has also, again, been to tell to employers that you are still responsible for their working conditions and their working environment. So your psychosocial risk assessment also applies to their home life. And that's even more challenging because, pre-pandemic, people who work from home are typically individuals who chose to work from home, who wanted to work from home, who were set up to work from home. And right now you've got individuals who, I'm quite comfortable working from home. I've had that privilege for even before the pandemic, but you've got individuals who are working off out of their beds, in their kitchens. And if you actually do a genuine psychosocial risk assessment of their working environment, that's not going to be great. And I think maybe it's because of again, lack of resources, time, energy. I think as a profession, we've also not really been paying attention to this, to raise awareness. Actually, we should be doing more of that. Not we have to. It's our legal responsibility to do that.
Yeah. Yeah, going back to what you said about startups as well, and how you say that they're probably been more attuned to, providing benefits to employees to attract and retain. I did read an article recently around how it was kind of like an expectation there'd be a table tennis table and a foosball table and that sort of thing when you went to a startup. But now when they talk to people who work in these roles, what they want is the same as what everyone wants. They want high levels of support from their colleagues and supervisors. They want greater levels of autonomy. They want manageable workloads. So it's interesting that the perks aren't seen as attractive as just good work design.
Yeah, it is. And actually, if you break it down, so I've got one of my cousins works for, or used to work for a number of the big social media firms out in California. And they worked on campuses, which has everything that you said, ping pong tables, they get dry cleaning, they had everything. And in the beginning, it's amazing. But actually, when you think back, there's almost an element of coercion.
Yeah.
If you do your dry cleaning here, if you do everything here, you can have a nap if you wanted to. You actually ended up working way, way, way more than what you did. You hang out with your colleagues in the office at the weekend because you played some beer pong or you went cycling around the campus, but then actually you dropped in and did a few hours of work as well. So there's an argument on, is there an element of manipulation that goes on in there? But I've got some colleagues who do some research around generational differences, and arguably that's also I think it's one of the myths that we have, where different generations need to be treated differently. And that younger generations want these things. And actually, when you ask what younger people want, and when you break them down and what older people want, exactly as you just said, Jason, they kind of want the same thing as well. So how you treat younger people isn't how you should treat older. You shouldn't treat older people any different. How you support individuals is the same across the board, really.
Yeah, and we've heard the same from other guests who have worked in, say, first responder populations, or, working in healthcare or wherever. And you go, well, these people are exposed to really traumatic things. And, some people are exposed to occupational violence, or, all these other things. And when you talk about, well, what are the things that actually cause people the most stress? It's the normal things like work overload and poor supervisory support and all the rest. So, yeah, it's really interesting how universal these work design elements actually are.
Yeah, definitely. We've got some involved in a research project with some firefighters in Brazil, and we're tracking them longitudinally. So they fill out surveys when they join, and then we track them every 3 years. And just picking out on the point that you just made, we then look at the impact of traumatic events on mental health and also post-traumatic stress, and we really see that actually it's working conditions which have an equal effect to the exposure to trauma. And then when you mix the two together, it just compounds that effect even more. And it just goes to show that, ideally in an environment like that, you're exposed to trauma, and maybe workload is always going to be high. Then it's so important to get those sort of resources, those hygiene factors in place, making sure they're supported, making sure they've got autonomy, making sure they've got good leadership and good teams, because that makes a massive difference in terms of outcomes later on. And we can track them 3 years, 6 years later, and it does make a difference.
Yeah, Joel shared an article with me recently, actually, about supports and demands, and how, what was it, Joel? It really does echo what we're talking about here, though, about, but the thing is, right, so you can throw all these.
Saying you can, so like employee benefits and their, I guess, their ability to offset demands. And, it gets to a point where it doesn't matter how many benefits you have. If you don't reduce demands, those benefits aren't going to offset the negative impact of the demands. So you can't just keep providing more and more benefits. You do actually need to do something to reduce the demands on people.
Yeah. Yeah. So we've said that for a while, you just can't keep offering more and more support. And that typically is the wellness approach, right? Let's give people more lunch and learns. Let's give them more like free gym memberships and that sort of thing. But at some point in time, you have to look at the work demands and look at reducing them to something reasonable.
Yeah, I think actually if you're providing genuine support, and I'm talking about things like good leadership, good teamwork, having autonomy, what that's actually allowing people, it's empowering people to then go back and address those demands. Because I think as a healthy team, you might be saying, do you know what? Someone is struggling. How can we support them better? Or you might be saying, actually, this is quite an ineffective way of us trying to do something. Maybe we can do this better. Or maybe we need to stand up for our rights and challenge authority and say, we can't work the way we work and things have to change. So I do think that if you are providing genuine support, and that's part of empowering individuals, then that should lead to lower demands. But if you are providing the more superficial stuff, as you said, Jason, your lunch and learns, your mindfulness, or whatever that might be. I haven't got an issue with mindfulness. Mindfulness on its own, if that's the only thing that you're doing, and saying, go and do some mindfulness, then that's not going to address the underlying issues.
Yeah, no, it's a really interesting point that you made there, Kevin, about how some of those supports do actually then help to reduce demands if they're implemented correctly. So hopefully our listeners picked up on that one.
Yeah, I think there's a distinction there between supports and benefits.
Yes.
They're different things. So benefits would be, what you would classify as a perk, I guess.
Yeah.
Whereas supports are actually they're known to, I guess, mediate the impact of those hazards.
Yeah, and the hygiene factors.
Yeah.
No, really good point. Now you've worked across industries. Obviously, you've got a fair amount of experience in healthcare, particularly, but you have worked across industries, as you've just mentioned. So, have you noticed any difference in terms of how different occupations or industries might be different in terms of their readiness to adopt psychological health and safety?
It's interesting. I think it's a yes and no question. No, in the sense that I think a lot of them are actually quite similar. they've got the same underlying issues or similar underlying issues. You've got the similar challenges that you face. But I think there are some subtle differences, although I think the caveat here is I'm talking in general, because even within industries, you have organizations who are on different stages of that readiness journey. I do think that sometimes working in the public sector, so healthcare, civil service, individuals are a lot more actually hesitant of outsiders coming in. So if you're an external consultant coming in, they're also reluctant, I think, to engage sometimes with change management, because there's just so much change that is always going on. There's always restructuring going on, particularly in the civil service. Every time you've got new government, things change. The healthcare service is in a continual evolution. So it's always, well, this is just more change. And therefore they're just tired. It's like, well, this is another cycle or something else that we have to do, something that distracts us. So there's a lot that needs to happen in terms of trying to win people over. And I do think what's interesting is talking to individuals within an organization and where they sit within a hierarchy and how they relate to the credentials of someone coming in. I think, and this is a very broad statement, I think there are elements in management, in particular senior management, that if you come from certain consultancy firms, management consultancy firms, that they're like, you're the expert, you're great. The more we pay you, then actually the more we get for our, you're more credible. I'm not going to name any firms, but we have the, organization X way and whoever's way, and that's what we're going to do. And I think on the flip side, if you talk to people lower in the organization, might go, well, they're just an expensive management consultancy that we're spending thousands, tens of thousands, millions on, when actually that money could be spent better. I think one of the advantages I have being, I would say, I call myself a practical academic, is that when I go in, I don't have that label, and I say, actually, I'm not here to tell you how to do your job. I'm here often much more from a research point of view to look at how we can change things, how we can improve things. And I think that helps me, at least, and I think some of my colleagues, because we might not be seen as being so focused on billing everything. And I think that's one thing which I've noticed, particularly in the public sector, in terms of the how people, how ready they are to change, and also how they relate to outsiders coming in. I don't know, what's your experience in that?
Yeah, it's an interesting one, as you say, going in and people perceiving you as either there to make money or there to just watch and observe. Yeah, I can totally understand. And it's that whole idea of cognitive dissonance, right? If you're paying a lot of money, then you kind of like, yeah, it must be a good service because I'm not a fool. Yeah, I find that quite bizarre. And we've definitely had those conversations. We're like, do we price ourselves so low that people then don't believe that it's a credible service that we're providing? So it's an interesting balance that you have to make. Yeah.
Yeah. I do like that approach of not coming in and being the expert, but asking people, and treating them as the expert. And I think that that's a really great way to get past a lot of that defensiveness, is to have genuine interest in people and, what do they do and how do they do it, and tell me all about it. And once you're actually asking people to be the experts and tell you all about what they're doing, their barriers really come down, and they actually really want to show you all the things that they know about their job and what they can do there and how things work. So I find that avenue is a really effective way of actually gathering a lot of information quite quickly.
But it's a key part of like change management or risk management. It's about consultation, right? So if you're coming in as the expert and saying, oh, we need to do this, then staff don't feel consulted and they don't buy into the change process anyway. So.
Yeah. I mean, there's genuine consultation, and then there's consultation where we'll basically herd you into the answer that we wanted in the first place. So, it's all called the same thing, but it's not actually the same thing.
I had a funny experience about that, actually. I was working for a small consultancy out of uni, and they wanted to introduce something new, a change in structure. And they thought, no, we'll engage the team and, we'll kind of lead them down this path, and hopefully they'll feel like they've come up with the decision that we've already come up with. We came up with a totally different decision. And so it didn't work. It backfired on them because they had to say, "Oh, thanks for your opinion, but we've already decided to do this."
Yep, it's a dangerous gambit.
Yeah, I mean, I find actually when I go in and sometimes when I talk to organizations, it's about saying, well, what are you actually planning to do with the results? Who's kind of accountability for it? Because if I'm going to get involved in a project, then and I know it's not going to lead anywhere, then actually that's not great. I mean, it's a waste of my time. It's particularly a waste on the time of the participants, of the employees who take part, because we know that, what's quite damaging. I've been in situations where I've gone in and they say, well, someone else has come in and tried to do this before, so what's the point? Nothing's ever going to change. So I think doing a program badly is potentially even worse, because you damage that relationship between employees and management. Potentially you damage that relationship, any goodwill that people might have between them. And also, if you take part, if you do if you do a program, whether it's badly or well, you actually create demands on individuals, because that's still time that someone needs to take to fill in a survey, to talk to colleagues, to take part in a focus group. And if it's an environment where someone feels really stressed and feeling like they can't cope, then that's actually not going to be good for them. I've been in situations, if I go in and run focus groups with nurses, for example, and that either means that they've stayed behind the shifts to do the focus group when they could have gone home and rested, or that they've done it during their shifts, which often means that their colleagues are short-staffed and their colleagues have to run around to pick up that slack. So I think there's also an ethical argument around what goes on. It's almost thinking that if I'm not convinced that this is going to necessarily lead to anything productive, then sometimes I do evaluate and think maybe the best thing is to do nothing.
Yeah, we've certainly commented on the irony of a psychosocial risk intervention actually creating psychosocial hazards or additional psychosocial hazards to the workforce, just through the nature of how it's implemented.
But it's just fundamental to understanding risk management, right? Understanding that when you bring in a control, it might bring in another hazard inadvertently. So
that butterfly creating hurricanes on the other side of the world.
That
Cheeky
butterfly
monster.
effect.
So let's talk about benefits, Kevin. It would be nice for companies to be, kind and caring and not care about money, but that's not the reality of the world. And what in terms of tangible benefits that you can talk to organizations about, what do we see as outcomes when psychosocial hazards are effectively addressed?
Yeah, I think we see a range of different outcomes, both in the research literature, but also if I draw on some of the practical experiences that I've had. A number of years ago, 2016, 2017, we wrote a report for the European Agency for Safety and Health at Work, looking at the financial cost of poor well-being in the workplace. And what we were able to do was try and draw on data from around the world. Australia was part of that report as well. So, the cost of poor mental health at a national level and what that might look like at an individual level. So that, I think, always provides some useful statistics to start a conversation with organizations to say, look, this is costing you something, and therefore, we should be doing something about this. And in terms of outcomes, we've seen, again, in the research literature, there are different rules of the different studies, but the general notion is that for the data that we have is that for every sort of dollar that you spend, at worst you get nothing back, so it's cost neutral. Or the data that we have suggests that it could be 1 to 3, so you get 3 times of that benefit back. So that's again not a bad place to start from a financial point of view. Looking specifically at some of the work that we did, we worked with a high street fashion retailer a few years ago, and actually what we were able to do, going back to your point, Joel, about safety culture data, we were able to link their safety culture data, which included measures of psychosocial risks, to store performance. So there are 100 plus stores around the UK, and it was quite cool to actually demonstrate that relationship, because that was actually the hook which brought that organization around and say, look, that's the data. that's the effect size, the relationship between your store Met scores and then how much money they make. So that was quite powerful. But generally, I think what we see is I really believe in when you try and do a well-being program in quick wins. As you said earlier on, you go in, involve the people, that participatory approach. They're the experts. So what's one quick thing that we can change straight away? And often they have an answer. And when we do that, you immediately see and notice a change in terms of goodwill, people being more willing to buy into the program that you are trying to run. And then later on, you do see changes in other elements, and that's sometimes it's around sickness absence, around employee engagement scores, and that's all positive stuff as well. So I think in terms of looking at some of my experience, both in doing research but also more practically, I think that's some examples that I have off the top of my head.
Yeah, that's really a good point that you make regarding, if employees see you actually take on their feedback around what a quick win would be and implement that quick win, how much, trust and faith that you can get for maybe bigger initiatives from employees as well. It's definitely something that Joelle and I have been advocating. Doing a traditional psychosocial risk assessment does require a fair bit of buy-in for the time involved in, employees doing surveys or operations, giving up staff to do that, or, running focus groups, all the rest. It all adds up to time and cost. And employees often have to wait a while to see actions from that. So Joelle and I have been advocating for, more frequent wellbeing check-ins where a line manager can, have a conversation with employees about work design on a much more frequent cadence and actually do things at a team level very quickly without needing, global approval to implement a big change project. Just do the quick wins that we can actually influence at a team level.
Yeah, in my experience, I'm always struck by how much of the quick wins that I've been involved in have revolved around coffee machine or similar sort of hot food or hot drink dispensing machine or availability of it. And I think it's because it's quick and it's easy. It's not necessarily too expensive for an organization to put into place. I think many individuals haven't got access to that, or in cost-cutting measures is one of the first things to go. We take your coffee machine away.
I've seen that.
I've got a story about that.
Yeah, I was going to say, have you got decent coffee in your offices?
Yeah, well, we have a coffee snob in the office, and he won't drink any of the stuff that I normally have.
Jason has a pod machine. It's no good, but we work like literally above a coffee shop, so that's all right.
Yeah. So the guys can have their Wanker coffees if they want.
How rude.
Well, yeah. As long as they're happy. But so I was going to go back, and I think I like that example, because it's easy and it's quick. And then secondly, because I think also it's not just about coffee, but it shows people that they've been listened to. And I think actually that coffee machine is also symbolic of that water cooler talk. That actually you're giving people a space. And if you give permission for people to use it, there's no use having a coffee machine which is locked away that no one can have access to. But if people can go and start having conversations around that, it fosters team climate, it fosters communication. And also if people are able to take 5-10 minutes to enjoy that coffee, whether it's instant coffee or whatever coffee you want to call it, Jason. It gives people a chance.
That's an Australian reference. It's from a comedian in Australia, so that's Australians will get it. Yeah, Jimmy Reese. Yeah. Anyway, sorry.
I'm pretty sure the British know what that word means as well, Jason.
But the term wanker coffee is specifically. Yeah, anyway.
There's no health or hygiene issues associated with that kind of coffee, international listeners. But
I do like that. I think these days with zip taps where you got the filtered water, that comes straight out of the tap, there's less time, I guess, for people to kind of mingle around a water cooler. So a coffee machine might be the way to go. But as a business owner myself, I see not only I see the underlying benefit that you're talking about, Kevin, in that people feel listened to and you're implementing it quickly, right? That's probably the best benefit. But from an employer's perspective, if people aren't spending 20 minutes to go downstairs and wait in line for a coffee, you're saving time, and when they come back, they're caffeinated. That means they're going to be more productive. So it's a win-win, right?
Yeah, the example that I have is that there was an economic downturn, and so the company that I worked for was like a subcontractor, and we were located within the client's building.
Yeah, I know
And
the
so
one you're talking about.
the client made the decision that they were going to, so their coffee machines were all on this like a monthly payment plan sort of thing where a contractor would come in and service them and fill them up with beans and all of that sort of thing. So they cancelled their contract and got rid of all of their coffee machines. We owned our coffee machines, but we had to put them in storage because the client no longer had their coffee machines on their floors and we couldn't have something that was better for our employees than the client did.
There you go.
But yeah, literally, the coffee shop at the bottom of the building did a roaring trade.
Oh, I can imagine.
Until the machines were reinstated, and yeah.
Oh, they would have loved
because you can, that's a clear line item in your budget. Yep, we've eliminated this cost, whereas the productivity cost associated with people popping down for coffee, that's absorbed, across lots of different budgets. So it's not a clear.
Yeah.
Look what we did, shareholders. Here's how we saved you money.
Yeah.
Yeah,
I think that's really important. It's organizations making decisions is not recognizing how you might save, I don't know, a small amount here, but not recognizing that it's got a knock-on impact on everything else. And in this instance, quite clearly, exiting the building to go and look for a coffee shop is going to eat into your time. I've got a brilliant story of someone I know quite well who worked for the civil service, and in the 70s, they had a very clear hierarchy in terms of promotions and what your benefits were at each stage. And he reached a level where he got his own office, but his building was sort of a below ground building, so there wasn't actually a lot of light. But he ended up in an office which was above ground, but that was beyond his pay grade. So what they actually did was they boarded up his windows, because it's not fair. It's not fair that for his other colleagues who were on the same level that they didn't have sunlight. And so
oh my goodness!
And it's like bonkers, and that's not of course it killed his morale, but other people going, what the hell are management thinking about over here as well? And some of the decisions that organizations come up with can be quite astounding.
Yeah, that's where you need the power of the people. There's a famous story here in Western Australia where there was a mine site that went on strike because they ran out of ice cream. So some benefits you just don't mess with, right?
Look, it gets hot in the Pilbara. You need that ice cream.
So besides coffee machines and ice cream, what have you found effective to support healthcare workers in particular to create systemic change? Noting that obviously during the pandemic, there's just been a worldwide shortage of healthcare workers, and we obviously can't necessarily reduce their work demands. So what are some of the other systemic changes that can happen, that can occur to support them?
Yeah, I think when we talk about systemic change, you need to recognize that change can and should happen across different levels. I think actually going back to your point with about the differences between industries, sometimes with healthcare workers, and again, I'm talking in general, there is this idea of saying, look, things are really difficult. There's just not enough staff, too many patients, working conditions are really bad, and there's nothing that we can do. This needs to be sorted out at a national level. And that is true. There's a lot of stuff that needs to be sorted out at a national level, but it doesn't mean that things cannot be done at a local, or shouldn't be done at a local level as well. But I think if I unpick some of that a little bit, so I said, I think at the start that some of the work that I do is about providing data that link working conditions with well-being and patient care. And the reason for that is to try and inform decisions at a national level to say, look, here's evidence to say that things aren't working or that things need to change. And I think you often need to recognize who your stakeholders are and what's important to them. If I work with organizations, often it's return on investment and bottom lines. In healthcare, it's patient outcomes, it's safety incidences, which are important metrics. So if I can link the well-being of staff to those metrics, it's more likely to generate interest and awareness. So I think some of the work that I do, or which I get healthcare workers or the stakeholders involved in, is about equipping them with the experience, with the knowledge, with the evidence to have those arguments that they can take to senior management, that they can take to policymakers, that they can take to government, so things that can change. So the narrative can change. It's not just about the individual, but it's also about things at a national or at a bigger picture level as well. But then at a local level, it's also important that things can change, because we've just talked about things at a team level, get that coffee machine in, or something similar, and processes can change how we do things, and that could be within a ward, it could be within a department, it could be within how we change things, how we deal with situations. And one of the things which we've noticed during the pandemic is where teams have had to evolve very rapidly. Either they've had to be formed, particularly to deal with COVID-specific situations where those teams have never existed before. So there aren't any policies, there aren't any procedures in place, or existing teams doing stuff and things have to change because they haven't had enough staff, or because, again, they have to evolve to manage COVID risks, where they've been given carte blanche to say, do what you have to do to run the service. And we've seen brilliant examples of innovation where people have changed the way the patient journey goes, on how they arrive in hospital and where they end up in the bed. Some of the training which healthcare workers go through, how they're supported through that process as well. So it goes to show that things can change at a local level as well when you allow people to say, look, you guys know your jobs, just get on with it and do it in the way that you think is best. I'll kind of end at that point and see if you wanted to come in and add anything to that.
Yeah, well, that's a big mistake I see a lot of companies do when they start dabbling in psych risk management. Often we're talking about secondary data and using employee engagement survey data. Often the decisions made from that survey are decided at a global level and interventions are brought in at a global level. So you're then generally talking about administrative type things like, we're going to bring in an app or a policy or training or something like that. And you're not necessarily getting to the needs of specific work teams. So I think you're right. If you can, think at that broader systems level, industry level, but really also recognize that teams should be empowered to make decisions about what's the best way to work for them as well. That's also systems thinking.
Yeah, and I think at the global level, within an organization, designing your policies and your strategies and standards in such a way that it actually provides flexibility for teams to make the decisions and make the changes that are going to be most appropriate or most helpful for them, rather than being really rigid in, what the rules are and how they're to be applied.
Yeah, so rather than policy just being a control on its own, it's actually opening up opportunities for other controls.
Yeah, it's a means of facilitating the implementation of control. Yeah.
Yeah, cool. Hey,
I think that's challenging across different, particularly in large organizations where you've got lots of quality control processes in place, where things can become quite bureaucratic, but they don't necessarily have to be that way. And a lot of examples of teams simplifying that process when they've been allowed to do that.
All right. So I guess to go away from talking about team level interventions, you've been doing some research that's actually looking at national commitment to systems level interventions to improve workplace mental health. Can you speak to that a little bit?
Yeah. So what we're interested, just come back now. So like I said at the start, we've done some work at a European level, which has been quite cool, to try and influence change within the European Union. You're talking about a body of 20. Well, it was 28. The UK's left, so now we're 27. That's a story for another day. But to try and create change across all of those countries, to share knowledge, really around psychosocial risk assessments, what we've just been talking about right now. And part of that process is around having national level legislation to encourage organizations. Well, legislation means they have to, but if it's guidance, then to encourage organizations that they should do something about this. And there's a big question mark around, well, just because we have a national guidance or we have legislation on this, does it actually work? Does it translate to the ordinary person on the ground? And we've been looking at some data over the last year. And what we see actually is that so what we've done is, again, link different data sets. So we've got, simple questions. Does a specific country have legislation or guidance at a national level that organizations should do something about that? We then have a European-wide survey of organizations. There's almost 35,000 organizations across Europe that fill out this questionnaire and ask them questions around health and safety. And then we have a employee working conditions survey, which is about 45,000 people who fill that out about their working conditions and about their well-being. So what we did was link those different data sets together, and what we find is that actually that national policies are associated with more organizations acknowledging that they do have organizational level policies to address stress. This is specifically focused on work-related stress, which then translates to employees reporting higher levels of job resources, and then lower levels of poor mental well-being. So that's the general picture. So that's quite cool, because we're able to demonstrate that, yes, when countries have the national level guidance, organizations do something about that, and it does translate to slightly better working conditions for individuals, which then translates to better well-being outcomes for individuals. When we explore that mechanism, actually, it goes via resources, so support in the workplace. It doesn't actually change the level of demands. So that was quite interesting. And it may be kind of alluding to some of the discussions that we've had over here. That's quite difficult to change demands. And maybe for organizations, it's looking at how can we create more support. But this suggests to us that actually, organizations focusing on support can have good outcomes for individuals.
Yeah, excellent. So I'm always really interested in research that looks at how that, I guess, those macro controls, the mechanisms that and how it gets through that process to actually influence the individual level, because so much research is just focused on individual level stuff. So actually looking at the mechanisms of how does a law directed at workplaces actually have a beneficial impact on individuals. I think that's fascinating stuff.
Yeah, and I think what's also quite cool is we kind of break that journey down. So national level to organization level to individual level, and all the different pathways. And there's lots of stuff that affect those relationships, of course. And I think that's why it's important when we see an individual and their well-being to see that we've got all those factors that come before that we also need to an extent, if we talk about collectively as a society, also need to address. And certainly at an organizational level, it's then looking, well, as an organization, what are we doing? And if you are involved, I guess, at a sectoral level and the industrial level, so between organizations, to actually recognize that you might have a voice to speak up, and to your decisions, again, will have an influence on your average worker as well. We've also plotted these, so I've talked about work-related stress. We've also plotted this for legislation around workplace bullying and workplace harassment. And over here, we find even stronger relationships than we do with work-related stress. We're trying to work out why there is, but one working hypothesis is that actually, when it comes to sort of bullying or violence in the workplace, that's something a lot more tangible. Organizations know that actually this is quite bad, that we need to do something around that. Whereas with work-related stress, it still is a little bit more ambiguous. You might have national legislation. Organizations might say, oh, yeah, we've got the policies, but how effective those are might vary. And again, the implementation and the reporting of it with work-related stress might still be a little bit more nebulous than violence. We often know what bullying looks like. We know what violence looks like, but stress is something which is a little bit more difficult to necessarily identify. We kind of know, but to quantify is a bit more difficult.
Yeah, it's an interesting one. I've seen some technology companies out there that their whole goal is to measure employee stress, whereas I think that's not really that helpful, because if you identify that employees are stressed, then you then have to work out what is the root cause of that stress. So why don't you just measure the root cause anyway and look to create a safe work environment, rather than just purely to work out how many people aren't coping with with job demands or whatnot.
Yeah. But I think it also just goes to show the importance of just having policies. And I think as part of any sort of psychosocial risk framework, I think it's important that organizations have policies on how you address certain things. So it's how, when it's stress, bullying, violence, mental health, what's the issue that you're focusing on? How will risk assessment fit into this? Because any decent policy should acknowledge that. And then how do you manage that process? How do you support individuals who might be struggling? How do you support teams that might be struggling as well? And I think that's the starting point. And if you already have a policy, then my advice to organizations always is review it. Is it working? Is it not working? I did some training a number of years ago, and an individual was so taken, he was so taken into this perspective of psychosocial risk thing. I never thought about this. All we do are resilience training and lunchtime talks. And he said, we're going to do this. I'm going to go back. We're going to write a stress policy. And then a couple of weeks later, he emails me and says, "Dear Kevin, I spoke to HR. We have a stress policy." So then the question is, well, you have a policy and that's not working. So the whole question then is, why isn't it? Why isn't it working?
Yeah, often they're quite broad, these policies. And what I really want to see in a health and safety policy that acknowledges psychosocial risks is, a commitment to periodically assess psychosocial risks. And Joelle has talked about her corrosion analogy previously, so we're not going to go into it again in this podcast. Kevin, Joelle can fill you in later. And also a commitment to provide resources to employees so that they can be aware of psychosocial risks in their own environment and take action at an individual level. But Kevin, this discussion has been really super interesting. I am aware that Joelle does need to do pick up this afternoon, and we could probably talk for another 2 hours with you very easily.
Yes, we could, but I'll get charged I'll get charged late fees for failing to collect my child on time. So aside from the parental shame that will be
you'll get that
poured upon me.
Yeah, absolutely.
Well, a good employer would pay that because it's work related while you're late.
But no, I can't deal with the shame.
I don't think that there's much that Jason can do to alleviate the
stink eye that you'll get.
The stink eye,
But Kevin, one of the questions that we always like to ask the guests, because everyone comes in with a significant amount of subject matter expertise, as you've clearly demonstrated you have again today, is what are your hopes for the future of workplace mental health?
I think my hopes is to see that actually health and well-being more generally is seen as a holistic perspective. So what I mean is two things. A, that it's actually everyone's responsibility. From the individual to the organization to the manager. It's not occupational health responsibility, it's not HR's responsibility. And that actually, when we talk about supporting mental health or well-being in the workplace, when we talk about supporting it holistically, what we talk about is actually good management. If you run a good team, a good organization, then actually you are probably inadvertently creating an environment where people feel supported, where people feel empowered, where people feel encouraged, and where people have appropriate workplace demands. And there's a lot of overlap between how you support someone or a workplace in terms of mental health, but also physical safety, and also other health issues, whether that is individuals returning from chronic illness neurodiversity in the workplace, long COVID, however you might address all of those issues is actually very similar. So a holistic approach to say it's everyone's responsibility and that it's about good management, then I think you will be ticking off a lot more than just mental health. And I think that's what my hope is.
Yeah, definitely a theme of our podcast, I think, is the shared responsibility, not just between employers and employees, but between HR and health and safety and all the other disciplines within an organisation as well. So, yeah, well said.
Yeah.
So do you have some words of advice that you'd like to share for listeners who are wanting to work in this field of psych health and safety?
Yeah, I think actually building on the point that I just said is, you know, whatever role that you're in right now, you play an important role already, because we've talked about enacting local change. And you can go in and you know, if I run training or similar webinars, I go to individuals and say, well, what's one thing that you can change in the next week or in the next 6 months that will create an improvement for yourself or for people in your team? Or how can you then lobby people in senior management to create change? So, you know, impact your local team, ask questions. If you're a manager, of course, you have more authority, you have more control about yourself, but also the people who work on that. And also that we've talked a lot about there's more softer skills, importance of communication, about winning people on board, about engaging individuals. And that's things that you can practice in whatever role that you're in. So build up that experience, build up those soft skills, ask questions, and recognize that well-being is a cycle, it's a journey. You'll never get it done. So that means we'll do something. If it doesn't work, we'll learn from it and we try something differently. So that's what I would suggest, is just practice within the role that you have. There will be opportunities for you to enact that or seek out experiences to do that. And then that will just, I think, stand you in good stead that if a relevant role or something that interesting pops up, that I think that would be in a good place to move into.
Fantastic. So look for opportunities for job crafting is what I'm hearing in psych speak there.
Yes, job drafting. We can again talk about that.
Another episode. Kevin, thank you so much for participating today. And again, thanks to Tim for recommending Kevin, because it's been a fascinating discussion today.
Good on you, Tim.
Yeah, I think Tim's going to send a finder's fee.
Yeah. Thank you so much, Kevin. Great insights there. We may ask you offline for some links to maybe some of the research papers that you've talked about, so we can put in our show notes, so that I know some of our listeners really like looking at that stuff. So that would be terrific if you can share. But thank you so much, Kevin.
Brilliant. No, thank you for having me, Joel and Jason. It's been wonderful. Have a good evening. And I think I'll just about crack on and start my work day now.
The magic of time zone differences. Well, listeners, that brings us to the end of the episode today. So don't forget, we do record these videos over YouTube, as Kevin worked out last minute, thankfully. So you can check out the video on YouTube. We will also share some of the video clips from today's session on our Flourish DX LinkedIn page, if you want to check those out. And there were some definite nuggets of gold that will be shared there. While you're on LinkedIn, feel free to connect with myself and Joelle, and I've seen Kevin over there as well. So if you want to slide into Kevin's DMs and find out more about his research, or maybe even studying at Birkbeck, then hit him up. So thanks again, listeners, and we'll catch you next episode.